All right, so it looks like people are coming in, so I'll go ahead and get started. Well, hello everyone. Welcome to today's webinar, Climate Change, Health Equity, and Public Health Law Learning and Practice Collaborative. My name is Maddie Kim, and I'm a Public Health Associate at the Network for Public Health Law with the Northern Region and National Office. So today we'll be discussing the upcoming Climate Change, Health Equity, and Public Health Law or Learning and Practice Collaborative, or Climate LPC for short. So we'll be providing a brief overview of public health law and how it intersects with climate change and climate-related issues. Throughout this webinar, we'll be using this web-based program called Menti to ask questions. I can give more information as we get to those questions, but this feature can be accessed through a computer or mobile device, or basically anything that can access the web. So if you have any other questions, please feel free to toss them into the chat or go ahead and use the Q&A function on Zoom, and we'll go ahead and address those at the end of the webinar. Just a reminder that this webinar will be recorded, and the recording will be available a few days after this webinar ends. So with that, I'll go ahead and pass it over to Jill.
Great, thank you very much, Maddie. I'm really excited to be part of kicking off this conversation about what happens when we place health equity at the center of our response to climate change. And it's a conversation that we hope will continue throughout 2022 and well into the future. Now, this is a little different from some of our other network webinars, which are focused on substantive presentations about the law and about public health. So I know some of you may be quite familiar with the network, and we're hoping that some people attending this webinar or listening to a recording later may be less familiar with the network. So I'll start with some brief introductions. The network is a national organization with 5 regional offices, and those regional offices are based in Maryland, North Carolina, Michigan, Minnesota, and Arizona. So in addition to serving the states in their geographic regions, each region focuses on specific public health law topics. And our Northern Region team, based in Minnesota, works with communities to address climate change across the country. Next slide, please. You'll hear from each member of the Northern Region team of 3 attorneys and a public health associate on today's webinar, and I'll introduce them to you now. Betsy Lawton is a senior staff attorney at the network's Northern Region office. Her work at the network brings a community-based lawyering approach to responding to climate change, declarations of racism as a public health crisis, and broadband infrastructure and access. Before joining the network, Betsy spent over a decade working to improve water quality as an attorney with Midwest Environmental Advocates and Minnesota Center for Environmental Advocacy, where she focused on Clean Water Act implementation and enforcement, reducing agricultural pollution, and preventing drinking water contamination. Betsy represented a broad range of individuals and communities facing water pollution problems. Betsy received her JD and a certificate of environmental law from the University of Wisconsin Law School and her Bachelor of Business Administration from the University of Notre Dame. Dr. April Shaw is a staff attorney at the Network for Public Health Law. She has expertise in breaking down the policy impacts of laws and appellate writing. Her current work focuses on racial health equity and suicide prevention. She is particularly interested in thinking through how multiple inequities intersect to create systemic disparities. April's experience in appellate writing comes from working as a senior law clerk at the Arizona Court of Appeals and writing appeals to the Board of Immigration Appeals. She previously worked at the Project on Predatory Student Lending at the Legal Services Center of Harvard Law School, and as the research scholar at the Center for Public Health Law and Policy at ASU's Sandra Day O'Connor College of Law. April earned her PhD in philosophy from the University of Colorado at Boulder, specializing in social and political philosophy with a focus on gender justice and critical race theory. She received her JD with distinction from the University of Arizona James E. Rogers College of Law. Maddie Kim joined the network as a public health associate through the Centers for Disease Control and Prevention Public Health Associate Program. Prior to her relocation to the Twin Cities, Maddie worked in local government, providing support to the city manager's office and served as a clinical volunteer at her local hospital. Maddie earned her BS in biology with a minor in public policy from California State University, Fullerton, where she conducted research on the influence of political culture on health system reform. Her areas of interest include health system reform, healthcare accessibility, intersectionality, and environmental health. I am Jill Krieger, the director of the network's Northern Region. My current work focuses on climate adaptation and mitigation, the Farm Bill and agricultural policy, mental health and well-being, and public health powers and duties. Before joining the network in 2010, I was a senior staff attorney at Farmers Legal Action Group, a public interest law firm that serves family farmers and their rural communities. I previously served as an assistant attorney general in the Minnesota Attorney General's office. I graduated with high distinction and Order of the Coif from the University of Iowa College of Law and from Earlham College. I serve on the board of directors of the Seward Community Co-op in Minneapolis, whose mission includes sustaining a healthy community. Next slide, please. At the network, we believe in the power of law to improve lives and make our communities safer, healthier, and more equitable. We help public health agencies and community-based organizations and individuals in many other settings access laws, understand regulations, develop policy, and make sound evidence-based decisions. So put another way, we help our partners to identify and overcome legal barriers and identify innovative legal and policy solutions in order to significantly and positively impact the health of their communities. Next slide, please. So the network operates in 4 key ways. We engage in legal research and analysis. That's the foundation of nearly everything we do. And the issue briefs, the fact sheets, the journal articles, toolkits, blog posts, and other resources we produce serve as valuable guides for our partners and the public at large. Knowledge building and training are conferences and meetings, webinars like this one, virtual and in-person trainings, workshops, and presentations build the capacity of those working in public health and in community-based organizations and other sectors to better understand, know, and use law and policy to drive change in their communities. We provide brief legal technical assistance at no charge, and then we can also make arrangements to provide more detailed strategic consultations and guidance, which may include in-depth research reports, collaborating to design action plans, and disseminating best practices. We elevate awareness on the role of law in providing a durable framework for equitable, healthy communities. And we help make connections for those for whom a 30-minute phone call with someone who's implemented a law or a change that they'd like to enact in their own communities might make all the difference. Next slide, please. Oh, this learning and practice, thanks, Maddie. This learning and practice collaborative is modeled in part after a long-standing community of practice among state privacy officers and data sharing experts supported by the network's Mid-States region. We hope that it will be informed by your ideas and energy. Next slide, please. To paraphrase one classic definition of public health law that was put forth by legal scholar Larry Gostin, public health law is the study of the legal powers and duties of the state to assure the conditions for people to be healthy, and the limitations on the power of the state to constrain the autonomy, privacy, liberty, proprietary, or other legally protected interests of individuals for the common good. And we're having this conversation at a time when the COVID pandemic and a deeper conversation about the laws and policies and structures that systematically create advantage and disadvantage based on race and a whole myriad of other factors, that conversation and those events have both obscured and made more clear than ever that there's a fundamental tension between these. There can be a fundamental tension between individual liberties and the common good. And so the duty of government is to strive to achieve a reasonable balance between the two. And that's the case with respect to climate change, as with many other things. And hand things over to Betsy.
Thanks, Jill. So when we talk about public health law, we take an expansive view and incorporate the social, legal, and structural factors that impact health and health equity. And in the public health terminology, the economic, environmental, and social conditions that impact health outcomes are called the social determinants of health. And the social determinants of health include many things that impact health outcomes, ranging from a person's neighborhood and built environment, access to stable housing, social connection, education, economic stability, and access to healthy food systems and healthcare, and many more things. This depiction that's up right now is of the social determinants of health, and it was created by Rakaya Yerbi. She's a professor at St. Louis University School of Law and the executive director of the Institute for Healing, Justice, and Equity. And it's really useful because it includes not just the social determinants of health, but the root causes and the tools that contribute to health outcomes and health inequities. And the root causes listed here include structural discrimination, such as racism, sexism, ageism, and the tools include political, budgetary, and legal tools. So when we think about the intersections of public health law and climate change, we're really looking broadly at many areas and types of laws that can impact health outcomes, promote health equity, help mitigate climate change, make communities more resilient to climate change, and help communities prepare for natural disasters. And the public health law approach assesses the community-wide health outcomes that result from existing laws and new laws and policies too, looking at both the barriers to health and opportunities to promote community-based solutions. Next slide, please. So as these past few years have made clear, climate change is one of the most pressing public health threats of our time. And the health impacts of climate change can be really overwhelming to list, but include, among other things, heat-related illness, increased respiratory, vector-borne, zoonotic disease and illness, and an increased frequency and intensity of natural disasters, which can cause physical harm and illness from things like flooding and fire, food insecurity, lack of access to clean water, displacement, disruptions to needed medical care and income and educational opportunities, and depression and anxiety. And these health threats will not be borne equally, with many frontline communities of color, aging populations, and under-resourced communities facing the first and worst climate impacts. And this inequity can be traced back to discriminatory policies that have shaped many communities. So for example, things like policies that limited funds flowing to communities both before and after disasters, that left little investment in preparedness and recovery efforts to improve resilience. And policies like redlining. Many formerly redlined areas are more susceptible to flooding, and recent studies have shown that these formerly redlined neighborhoods are on average 5 degrees hotter than non-redlined neighborhoods, making them more susceptible to climate change as we move forward. This slide lists a sampling of climate change and public health law policies and issues, not policies and issues. So those are issues related to a wide variety of things, laws and policies that can help mitigate urban heat islands, water quality and quantity impacts, and questions around what local communities are doing to reduce the health threats from flooding. Laws and policies that can help prioritize community voices as part of emergency preparedness and recovery efforts. Laws that can be used to address climate gentrification, green infrastructure and opportunities for promoting access to nature and green space for kids in school. How laws and policies help address the mental health impacts of climate change and natural disaster. Legal developments that can help ensure community-derived solutions are implemented. state laws that can bring the benefits of solar energy production to tenants in multifamily housing units, and things like how communities can ensure investments in climate resilient strategies promote health equity and account for past inequities. And there's many additional issues that are coming to the forefront every day, issues around equitable access to clean transportation, et cetera. And this list is, in no means comprehensive. And we imagine that the collaborative will identify and tackle other issues that are important to your community's health in the face of climate change. And we're really interested in learning more about your priorities. We'll have some time in a few minutes to learn more about those priorities from you. But now I'm going to hand it over to April for a discussion of climate change and racial equity.
Thanks so much, Betsy. So in thinking through these issues and other issues that Betsy just mentioned, we want to center the work in a racial health equity framework. And this requires thinking through some core factors, including the existence of systemic and structural racism. In thinking about systemic racism, you have to think about not only race-conscious laws and policies, but overtly race-neutral laws and policies. And also being cognizant of the reality that not everyone is equally impacted by climate change. Many of the impacts are racialized, as Betsy just mentioned. For example, the EPA just recently released a report on climate change and social vulnerability in the US, looking at some of the primary climate change impacts, and it uncovered unjust racial disparities. And I'll just name a few examples from that report. For example, the report concluded that Black and African American people are 40% more likely than people who are not Black or African American to live in areas with the highest projected increases in mortality rates due to climate-driven changes in extreme temperature. It also found disparities in wage losses that affected certain groups of color. For example, it found that Hispanics and Latinos or Latinas are 43% more likely to live in areas with the highest projected labor hour losses in weather-exposed industries such as construction and agriculture. The report also found that American Indian and Alaska Native peoples are 48% more likely to live in areas with the highest percentage of land expected to be inundated due to rising sea levels. Designing solutions that account for these inequities and their root causes and that do not perpetuate a system where people of color are worse off calls for examining historical and current laws and policies that create such uneven impacts. Understanding intersectionality and applying that lens is also crucially important. And I'll give two examples that illustrate why. ProPublica recently assessed exposure to cancer-causing industrial air pollution and found that in census tract areas where most residents are people of color, they are subjected to 40% more cancer-causing industrial air pollution on average than in census tract areas where the residents are mostly white. Such inequities further fuel new inequities when other threats emerge, such as COVID-19. Harvard researchers found that long-term exposure to fine particulate matter air pollution correlated with greater county-level COVID-19 death rates. That is, specifically, they found a small increase in this exposure led to a large increase in COVID-19 death rates. The merging of the COVID-19 pandemic with an existing regulatory system that exposes more people of color to pollution has served to further deepen existing inequities. Another example comes from urban heat islands. Researchers examining disproportionate exposure to urban heat island intensity found that the average person of color lives in a census tract with a higher summer daytime surface urban heat island intensity than non-Hispanic white people in almost all of the largest urbanized areas in the US. In Arizona, which is well known for its heat-related deaths almost doubled in 2020 to 494 deaths compared to around 200 in 2019. A 2018 county report from Maricopa County in Arizona found that Native American and Black people had the highest rate of heat-associated deaths. What people also uncovered was during 2022, the number of cooling centers decreased dramatically due to the COVID-19 pandemic. And many of the deaths that occurred were among people who were homeless. Again, looking at an intersectional lens, we know that Black and Hispanic people have been the hardest hit economically by COVID-19. So what these examples show is that we have to think holistically when we're thinking about climate change and solutions, and we can't be single issue focused. We have to take a broad view of the different factors that create multiple and overlapping inequities. Another important consideration is applying a racial health equity lens to the burdens and benefits. It's not enough to simply point out these disparities, but we need to understand the drivers. And that means talking to impacted frontline communities. And that means talking to communities of color. But it's just important to include impacted communities, not when we're thinking about the burdens or the inequities and harms, but we're also when we're thinking about solutions. So we can ask questions like, was there community input? At what stage did we get that input? Does our work align with what community is asking for? And I think what's crucially important is who will be the primary beneficiaries of the solutions that are proposed. As the examples that I just discussed show, aggregate solutions can leave in place deep racial inequities. And now is the time to think about how to promote racial health equity and not further entrench inequity in our climate solutions. That means we cannot treat localized inequities in our communities as unimportant. Otherwise, we'll just recreate a system with deep pockets of inequality. And finally, the final point that I wanted to highlight is the question of which community. So the Learning and Practice Collaborative part of what we're going to be doing is working through strategies to be more inclusive and to really understand what inclusion means, including not seeking input at the end, but from start to finish, and how to make that input easy and accessible for impacted communities. And with that, I'll pass it to Maddie to fill in the details about the Learning and Practice Collaborative and to pose some questions to the group.
Thanks, April, and thanks, Jill and Betsy as well. So before we dive into that overview of the Learning and Practice Collaborative, we just wanted to hear from you all how climate change has affected your community and your work. So we're going to be using Menti. So if you look on the screen, there's a link to go to menti.com. And once you visit that website, you can input a code and you can just share with everyone how climate change has affected your community. And just please note that the answers will be visible to everyone. But I'll go ahead and give everyone a minute just to visit that website. If you have any questions, just toss them into the chat.
And I'll just add, the answers will be visible, but I believe they will be anonymous as well.
Yes, thank you, April. Okay, and we did receive a, message in the chat as well. So someone mentioned storms. We're seeing wildfires and flooding as well. Agriculture and flooding. Flash flooding. We're seeing increased storm intensity as well. Heat. heat again and lack of rain, someone had specified in Central California. So thank you. I did receive a message that this folks might be seeing the incorrect slide, but I wanted to just say thank you to everyone who's still submitting messages in the chat function. So failing septic systems due to high water table. Thank you. And so with that, I'll go ahead and go to our next question. So this one is a little bit more specific. Let me go to the next one. So this next one, you can also feel free to use menti.com and go ahead and use that code as well. Or if you'd like to continue submitting in the chat, that's fine too. But specifically, what kinds of legal and policy barriers and opportunities have you encountered when addressing these climate-related issues? So we see insurance rates increasing. Being dropped from homeowners insurance plans, bans on bag bans, or agreement of policies across multiple municipalities. The inability to make government address them. So needing a fundamental right to healthy ecosystems that protect public health that can be enforced in the courts. Land no longer being available. I see funding is just a very common issue. Housing scarcity, housing insecurity, increasing energy costs. Looks like politics is a large one. Construction codes. Thank you all for submitting. This is very eye-opening. Seeing political will again. All right, so thank you so much, everyone, for submitting these messages. We'll go ahead and continue on with sharing more about the Climate and Learning and Practice Collaborative, but please, if any others come to mind, please feel free to share them in the chat. So I'll go ahead and pass it back to Jill for her to continue providing an overview. And thanks again, everyone. I'll go ahead and start. So just letting everyone know, so the Climate Change, Health Equity, and Public Health Law Learning and Practice Collaborative is what we're aiming to provide opportunities for individuals interested in learning about and taking action at the intersection of climate change, racial and economic health equity, and public health law. So that sounds like a lot. So I'm gonna go ahead and pass back to Jill, and she'll dive a little bit deeper into what we're aiming to do and some of the timeline. Jill, I think you might be on mute.
Thank you, Maddie. So as Maddie just said, we know that climate change is a big issue and that can be daunting. And we know that finding funding for work on climate change and health equity is an ongoing challenge. And we know that many of you out participating in this webinar are at varying points in your sort of learning and journey in this work. And so what we've attempted to do is create several pathways for people to participate in these climate and health equity and public health law initiatives that we're launching with today's webinar. So the first pathway is really perhaps a comfortable place or a good fit for those who may be new to these issues and just really eager to build a base of knowledge and acquire that knowledge and hear from experts about a variety of climate and health topics as they relate to law and policy. It might also be a good fit for those who have limited time to dedicate to this work. And so pathway one really would be attending webinars, accessing our legal resources, and perhaps seeking legal technical assistance. Pathway two would be full participation in the Learning and Practice Collaborative, and that would require an application. And that would provide opportunities to participate in facilitated discussion and problem solving, and opportunities for you as participants in the collaborative to both benefit from as well as offer guidance to peers in the collaborative. And again, would provide the opportunity to seek brief legal technical assistance. Now, frankly, the network provides limited legal technical assistance essentially to anyone who wants to use the law to improve the health of their community. At some point, if we are receiving repeated questions that are similar, then we might create a resource and share that resource rather than providing more individualized legal technical assistance. And just to step aside, when we use the term legal technical assistance, we're creating a distinction between that technical assistance and legal advice. So in the collaborative, we would not be forming an attorney-client relationship with participants, nor would we be providing legal advice. But legal technical assistance provides legal information and analysis that we then recommend that you can share with and discuss with your legal counsel for legal advice and to make decisions about next steps. And then the third pathway, as we have thought about ways for people to participate in this learning and collaboration related to climate change, health equity, and public health law, is participating in our upcoming Climate Change and Health Equity Summit. So, this collaborative has been designed then to culminate in what is the network's first ever climate summit. And Maddie will share more details about the summit toward the end of this webinar. But essentially, some of you may be familiar with the network's National Public Health Law Conference, which typically happens in alternate years and covers the gamut of public health law issues. Our summits, the network hosts summits to take a deeper dive into a particular topic, perhaps support more intensive networking, and allow more flexibility in the design and structure of sessions. So we're looking forward to crafting that summit really in collaboration with those of you who choose to come on this journey with us. So we're really excited and hope that having these three different pathways will provide different ways for people to participate. Next slide, please. The timeline for all of this is set forth on this slide, and we can just walk through it. Our plan is to have applications available and posted on the network's website by no later than December 9th. And then, and the goal of the application, again, is for those who would seek to participate in the facilitated discussions and shared problem-solving activities. It's not going to be a super in-depth or burdensome application, but just enough to give us insight into the experiences that people would bring to the collaborative and the goals that people would have for the collaborative, so that we can create a good mix of peers to learn together and work together. We'll begin the core experience of the collaborative in February, and that will go on through next summer. Our current thinking, again, subject to input from all of you, is that we would have monthly opportunities alternating. So we would have in 1 month a webinar, and then in the next following month, a facilitated discussion for those members of the smaller Learning and Practice Collaborative. And then the Climate and Health Equity Summit is scheduled. At this point, we're hoping to have an in-person gathering in Minneapolis in October of 2022. Next slide, please. Oh, so this is the Menti question that I think was showing on some people's screens earlier. So we've already got lots of input. This is fantastic. What are some climate and health equity topics that you would like to see webinars on? And I'll just note, you're also free to submit more than, I think, up to 3 answers through the Menti platform. I have to say I'm not wearing my reading glasses, so I'm not sure I can read all of those responses, but we will record all of these, and this will be really valuable in getting a sense of what kind of themes emerge, what kinds of questions are shared among a lot of you, or are really pressing concerns. So they might be, types of, you might frame your health equity and climate topics as types of weather, or as health threats like asthma or Lyme disease, or it might have to do with legal doctrines such as preemption, or how procedurally can public health departments and community-based organizations work and collaborate together. Maybe looking at how could a community health needs assessment and a community health improvement plan help support efforts to address climate change and increase health equity. In terms of racial equity, how might civil rights laws be brought to bear? What types of funding resources are available in the American Rescue Plan Act or the infrastructure bill that was just signed yesterday to support initiatives related to addressing climate change and improving health equity? So I'm just listing kind of categories of topics, but really eager to see, to have a chance to review some of the subjects y'all are sharing. Keep them coming. We're in no hurry, I think. So let's see. While folks are continuing to answer that question, we don't need to go to the next slide yet, Maddie, while folks are still contributing. I think they're still contributing. Perhaps it's just circulating. We did want to talk about, folks might have questions about, well, am I the kind of person who should apply to participate in the Learning and Practice Collaborative? And if there's one thing that you can walk away from this webinar with, I hope it will be that this is an interdisciplinary initiative, that we will benefit from insights and experiences from a range of professional background, from lived experience, but very interdisciplinary. And so I think we can go to the next slide, please, Maddie. Really, the core requirement for folks who want to apply would be a commitment to addressing the health impacts of climate change, advancing racial health equity, and using law and policy as tools to achieve these goals. So if you meet those baseline, if those are areas that you want to work in and be in conversation and dialogue in, and increase your skills, broaden your network, increase your knowledge, then we'd encourage you to consider applying. So you might be working in a variety of different settings, and we list them here in the slide. Certainly public health departments, certainly community-based organizations, but not just those two. You might be working in a legal organization or at a state attorney general's office. You might be working in a healthcare system, at a hospital or clinic, or a professional association for healthcare providers. We know that there are certainly many opportunities there. AHRQ has recently issued a request for information about how the healthcare system can reduce its climate footprint and increase health equity as it does so. You may be working in local, state, tribal, and federal government. You may be working for one of those places that does fund this type of work and want to learn more, hear directly from people who perhaps aren't your grantees, but what kinds of things they're working on, what their needs are, you'd be welcome as well. Next slide, please. Okay, I think I'm handing it back over to you, Maddie.
Yes, well, thank you, Jill, so much for that overview. As Jill mentioned, we will be hosting a Climate Change and Health Equity Summit in the fall of 2022. So I just wanted to raise that for everyone's awareness. So it will be taking place October 12th to the 14th at the Royal Sonesta in Minneapolis, Minnesota. It's downtown Minneapolis specifically. And the summit will focus on sharing timely information and enhancing collaborative partnerships on key issues related to equitably addressing the current climate emergency. So we are hoping that any dialogue or lessons learned in the Climate Learning and Practice Collaborative will help us create a summit that is truly indicative of what the needs are in the community. And with that, I wanted to just ask one final question. We want to make sure that all of you are involved at every step of this Climate Learning and Practice Collaborative. So using Menti again, or just popping it into the chat, please let us know how both the network and your fellow peers can support you through this Learning and Practice Collaborative. Okay, someone has mentioned knowledge sharing around how to get evidence or ideas into implementation on local levels, providing resources. Also serving as a resource for ideas and information about how we can change our work into the future to better serve equity across the state. Specifically, this one was Washington. Providing current policies that folks can use as templates. Providing tips on ways to build organizational leadership or supporting members successfully attaining positions in organizations to push for these movements and policies internally. I see another on sharing data types used to prove necessity that could be parsed from local data. Thank you. This has been very helpful. Please continue to just pop them into the chat or onto Menti if as you think of them. I'll go ahead and continue from this point. So we also just wanted to give the contact information of the folks at Northern Region. If you have any other questions that pop up or things that you'd like to raise as we continue on with this Learning and Practice Collaborative, or even the summit as well, please feel free to just message any one of us. And with that, I just wanted to open up some time for any other questions from the audience. Please feel free to submit them here or in the chat function on Zoom. It could be questions about the Learning and Practice Collaborative or anything we've mentioned about public health law and its intersection with climate change.
Maddie, while we're while we're waiting for folks to submit questions, I did see that there was a question that came through the chat that Betsy answered. Betsy, I wonder if you'd want to share that answer with folks.
Sure. Let's see. I'll make sure I get the question right. So the question was, why isn't the natural environment included in the social determinants of health? Without environmental health, there is no public health. And I think this is a great question. We do consider the natural environment to be part of the social determinants of health. And sometimes natural environment is included in the terminology for the built environment. And the requester's environmental engineer and really clarified that these are two different things, the built environment and the natural environment from that perspective. And so I really appreciate that. Jill and I did draft an article last year, I believe. Time is all sort of a mess since COVID hit, that talks about the benefits of including very specifically the natural environment as a greater focus of public health law opportunities to address climate change. I put a link to that article in the Q&A, but certainly we'd love to hear more about your thoughts. Jill, do you have anything to add based on some of the work we did in preparation for that article?
I think you covered it really well, Betsy. We looked in that article pretty closely at, I think, environmental laws specifically related to water quality and the Clean Water Act, as well as agricultural law, and just provided examples where addressing the natural environment as a social determinant of health makes sense because it impacts the health of populations.
Great, thanks, Betsy and Jill. So we do have another question. So this one is asking if there are any new insights or topics emerging from COP26. So that was referring to the United Nations Climate Change Conference that just occurred. I'll pass it on to Betsy just to start. And Jill, if you had any other thoughts, feel free to add in April as well. Betsy, I don't want to put you on the spot, so.
I was trying to multitask. I was looking for a link to the article to put in the Q&A. Jill, do you want to start off with that? And then I'll catch up here once I get that link done.
Sure. Unfortunately, I was also looking for the link. Okay. Any new insights and topics emerging? Well, I mean, it's an enormous event. One thing that I was struck by is that there seems to be movement forward on addressing methane. When we talk about climate change, I think folks tend to focus a lot on carbon emissions, and with good reason. But some of the super climate pollutants that can be really problematic in the short term, including methane and HFCs, really need to be dealt with quickly as well. And so there has been progress on the international stage toward an agreement to address methane, actually building somewhat on the Montreal Protocol from, gosh, when was that? The 1990s? Might be misremembering my chronology, and the Kigali Amendment to the Montreal Protocol to address HFCs. So I think those are two of the things that I was pretty excited about.
Awesome, thank you. And so we do have another question. So this one, I believe, is referring to the recent infrastructure bill signed under this current administration. So will the new infrastructure bill take into account any of the research or advice from public health groups? So I'll go ahead and just open it up to anyone, April, Jill, or Betsy, who would like to start us off.
So more to come on that, I think, is my initial answer. We have been working in collaboration with the Medical Society's Consortium for Climate Change and Health. So this is medical professionals who are seeing the effect climate change has on their patients, and who also recognize that when medical healthcare providers speak with respect to climate change, their words have a lot of credibility. So it was way back in 2019, we collaborated on an issue brief to address renewable energy standards and renewable portfolio standards. And things have slowed down a bit, or we've been, everybody's been engaged with responding to COVID, but we have been discussing this fall. They had been working on a brief to address some of the aspects of the infrastructure bill. And so we are exploring the possibility of collaborating on, resources in that bill to address public health threats and challenges. So I don't want to speak out of school. I hadn't necessarily, that's all under development, but I think there will be resources and funding sources available in that bill, but we'll need to engage in the analysis to see what is in and out of the final bill and do that analysis. So that's why my initial analysis, I stand by it, more to come. So folks, I'm terribly sorry. It appears that we had some technical difficulty that resulted in the webinar being cut off. Looks like just a few of you are still on, but maybe some others will try to rejoin. We were just about at the end, fortunately, but if anyone who is still on has any outstanding questions that you want to ask in the remaining minutes, we're certainly glad that you joined the webinar and either we're able to stay on or rejoin with us. Appreciate the dedication. And otherwise, I do know that the recording and the slides will be available following the webinar, and we can certainly in the message let folks know what happened. And again, extend our apologies about that. I don't think Maddie's or Betsy have been able to rejoin either. So again, I hope this webinar has provided a good overview of the kinds of the approach we'll be taking to the Learning and Practice Collaborative, both in terms of the substance and the different pathways for people to participate. And again, really appreciate people's participation throughout the webinar with the Menti questions, really eager and looking forward to reviewing all the responses that we received, and that will help us as we continue to plan for the launch of the collaborative and for the summit. Again, just reviewing the timeline, we will have the application for those interested in participating in the collaborative up on the network website by no later than December 9th, and applications will be due by January 20th of 2022, with the launch of those webinars and facilitated discussions beginning in February. Okay, so again, thanks for those of you who were able to hang on or join back in. And looks like Maddie has not been able to rejoin, but just want to thank Betsy and April, and Maddie did a lot of the legwork on this webinar, so I'm sorry she's not here. But thank you all, and look forward to being in touch in the future.